The management of breast cancer is highly individualized based on factors such as tumor subtype, stage, hormone receptor and HER2 status, and patient-specific considerations. For early-stage breast cancer, the treatment paradigm includes surgery with or without radiation therapy, and adjuvant therapy to reduce recurrence risk, including endocrine therapy, chemotherapy, HER2-targeted agents, and CDK4/6 inhibitors in HR+/HER2 cases. For metastatic breast cancer, treatment goals focus on disease control, symptom management, and quality of life. First-line therapy depends on receptor status. For HR+/HER2-, endocrine therapy with CDK4/6 inhibitors like palbociclib, ribociclib, and abemaciclib. For HER2+, HER2-targeted agents like trastuzumab, pertuzumab, adutrastuzumab emtansine, and trastuzumab deruxtecan, and for triple-negative breast cancer, chemotherapy remains the mainstay, with immune checkpoint inhibitors for PD-L1+ cases and antibody-drug conjugates. Now, let's discuss FDA-approved medications and their adverse effects. For hormonal therapies in HR+ breast cancer, tamoxifen is used in both pre- and post-menopausal women, with adverse effects including hot flashes, thromboembolism, and endometrial cancer risk. Aromatase inhibitors like anastrozole, letrozole, and exemestane are used in postmenopausal women, with adverse effects such as bone loss, arthralgia, and cardiovascular risks. CDK4/6 inhibitors like palbociclib, ribociclib, and abemaciclib are combined with endocrine therapy, and their adverse effects include neutropenia, fatigue, and QT prolongation specific to ribociclib. For HER2-targeted therapies, trastuzumab and pertuzumab are the standard of care for HER2+ disease, with adverse effects including cardiomyopathy and infusion reactions. Adutrastuzumab emtansine is an antibody-drug conjugate for HER2+ metastatic breast cancer, with adverse effects such as hepatotoxicity and thrombocytopenia. Trastuzumab deruxtecan is approved for HER2-low and HER2+ metastatic breast cancer, with adverse effects including interstitial lung disease and nausea. In chemotherapy and antibody-drug conjugates, sacituzumab govitecan is a TRO2-directed antibody-drug conjugate for triple-negative breast cancer, with adverse effects including neutropenia and diarrhea. Capecitabine is an oral fluoropyrimidine chemotherapy, with adverse effects such as hand-foot syndrome and diarrhea. For immunotherapy, pembrolizumab is a PD-1 inhibitor for triple-negative breast cancer with PD-L1 expression, and its adverse effects include immune-related toxicities like pneumonitis, colitis, and endocrinopathies. In terms of biomarkers and gene therapies, patients with BRCA1/2 mutations benefit from PARP inhibitors like olaparib and talazoparib, with adverse effects including anemia, nausea, and fatigue. PIK3CA mutations can be targeted with alpelisib combined with fulvestrant for HR+/HER2 breast cancer, with adverse effects such as hyperglycemia, rash, and diarrhea. Emerging therapies are targeting endocrine resistance in ESR1 mutations, and TRO2 expression is targeted by antibody-drug conjugates like sacituzumab govitecan. The newly defined subset of HER2-low patients benefits from trastuzumab deruxtecan. Thank you for your attention.